Okay, hi, we're here at the infamous Bonnie Lane Club. This is really my basement where I train and hang out. The boys are hanging out in the other room. All right, then, come on. Okay, so just a friend typed in, just asked me about knee pain. Feels like he gets knee pain. He has a history with meniscus surgery in his knee 3 to 5 years ago-ish. And still has some knee pain with walking, anything with impact. And I want to troubleshoot a few common things that cause that kind of knee pain. Now, it could be any of these things, and that's a disclaimer. It's hard to say without testing you and looking at your form, looking at the details, stress tests on the knee. There's a number of things we do to try to pinpoint the treatment approach. But here are the most common things that you can at least self-assess to the best of your ability. And number one, we start with the ankle and foot. If you walk with avoidance of loading the ball of the big toe, that can be a very common cause of knee pain. That's the first thing, the most distal thing we look at. Does your great toe dorsiflex? Because if it doesn't dorsiflex and you end up walking around that thing, you end up tilting on the outside of your foot, it puts side-to-side torque on your knee. So that's one thing we look for, common thing we look for. Another thing that will cause a similar thing is if your arches are high and your foot's tight, if your arches are flat and your foot is super loose, that'll also, if your foot's loose and low arch, you'll tend to push off laterally because it feels very inefficient to load the ball of the big toe. So look for that ball of the big toe issue. And a third thing at the ankle and foot that will cause a similar thing is if you have a crappy shoe or a good shoe, any shoe that's really worn out laterally, and it kind of pushes you out, and it puts this varus stress at your knee, right? Lateral stress at the knee from a crappy shoe. So watch out for a really worn out shoe or just a flimsy shoe. Sometimes that'll happen and cause problems at the knee. Now, if you have problems that impact when you first strike your heel down, another thing, if it's on one side and not the other, look for a leg length discrepancy. Sometimes one leg's a little bit longer than the other, either from a tilt of the pelvis or lower back, or from just truly the bones are a different length. And when you walk, you kind of plop down and hyperextend one side, usually the shorter side, but not always. So that's another thing just to look for in general, a leg length discrepancy. Okay? At the actual knee joint, knees usually hold up pretty well to flexion extension, but when there's side-to-side movement, torque in, torque out, twisting force, knees don't like that. And we look for that. So just watch when you walk and when you move, when you squat, going up and down stairs. Look for extra movement in and out, twisting type movement. And it's hard to think, a lot of things can cause that. It could be truly muscular weakness at the hip, and that's what we're going to move to next. Common thing that causes knee stress at the hip. If you sit a lot and your hip flexors get tight, maybe you're a bike rider, and a lot of times over time, you straighten out and you kind of look like this because your hip flexors are tight. Your pelvis is tilted forward. I'm exaggerating, right? So another thing you've got to really look for is find a way to stretch the hip flexors that doesn't irritate your knee in the meantime. That can be tricky. You can put a pillow down and do this kind of thing, right? And get tall. You're trying to stretch your hip flexors because that gets tight in almost everybody above 40 if you sit a lot. So you look for that hip flexor tightness. Sometimes you can look for internal and external rotation problems at the hip joint. So a lot of times you have to look at those things at the hip, especially that hip extension gets limited over time, and it does cause you to shuffle with your walk. It causes you to lose movement here, and you make up for it at your knee or at your foot and ankle. So that's some of the things to look for. I know it's not a lot of help in the actual treatment, but maybe at least you can look for some of those things. You can even YouTube and Google like hip flexor stretches. That's a good start. I may do a few with a follow-up video, some actual treatment. Okay, thanks.